My case study is asthma. Patient is a 64-year-old adult male. He presents to the ED with difficulty breathing. He reports difficulty breathing, tightness and pain in his chest, anxiety, and his heart is racing. Auscultation of breath sounds reveals wheezing and diminished breath sounds on inspiration in lungs bilaterally. Appearance of client shows diaphoresis, distress, using intercostal muscles to breathe, shallow respirations, cyanosis of nail beds, and a barking cough. Client's vitals are blood pressure 155/85, heart rate is 128, respirations are 30, temperature is 39 degrees Celsius, and oxygen is 90%. Treatment includes raising the head of the bed to improve oxygenation, administer albuterol sulfate to open up the patient's airways, and then administer ipratropium bromide to relax the bronchial airways. And he's put on 2 liters of oxygen via nasal cannula, and the patient is admitted to ICU for further monitoring and testing. Patient had some blood work done, and significant labs show that his neutrophil count is 74 and the normal is 40 to 60. Lymphocytes show 56 in the patient and normal is 20 to 40. Eosinophils is 8 and normal is 0 to 4. Studies show that airway during asthma exacerbation suggests an inflammatory infiltrate of neutrophils, eosinophils, and mast cells. Also, lymphocytes are increased in patients with uncontrolled asthma. Was the initial treatment for the patient presenting with these symptoms? First up is raise the head of the bed and do not leave them alone. Raising the head of the bed improves oxygenation. Question 2, what is the first medication you expect to administer? Rationale is administer rescue inhaler albuterol sulfate. It is the first line of treatment because it will open up the airways to help the patient breathe. Question 3, will the patient require oxygen therapy? Rationale is yes. Evidence-based practice suggests patient setting of 90 or less will need oxygen therapy. Day 2 assessment of patient. Patient's vitals show his blood pressure is 145/85, his heart rate is 100, respirations are 25, temperature 39 degrees Celsius, and oxygen saturation 90. Patient's vital signs have slightly improved. Patient's nail beds are no longer cyanotic. Accessory muscle breathing has decreased from moderate to mild. Auscultation of breath sounds still reveals wheezing, diminished lung sounds. During the assessment, patient reveals to the nurse that he started a new job in a sawmill and that he had childhood asthma that resolved and has not had symptoms since he was a child, but patient still states chest tightness and difficulty breathing. Day 2 questions. Question 1. What medication do you expect the provider to prescribe if albuterol and ibuprofen have not been effective? Mag sulfate. If albuterol and ibuprofen have not been effective, mag sulfate will be used. Question 2. What kind of asthma do you foresee the provider diagnosing the patient with? Rationale is occupational asthma. The patient experienced an exacerbation at the workplace due to sawdust. Question 3. What test measures how well the patient is breathing? A lung function test will show how well the patient is breathing. Treatment for day 2. Provider prescribes mag sulfate. Nurse administers the medication via IV. Patient continues to receive oxygen at 2 liters via nasal cannula. Patient is to receive ipratropium and albuterol combination, also called DUNEB, after course of mag sulfate. Labs for day 2 include white blood cell count. The patient's count is 15,000 and normal is 5,000 to 10,000. PCO2 is 50 and normal is 35 to 45. IgE is 1,000 and normal is 180 to 300. Day 3. Patient's physical assessment reveals vitals are blood pressure 130/80, heart rate is 75, respirations are 22, temperature is 39 degrees Celsius, oxygen saturation is 94, patient rates pain 2 out of 10 and states it is a tolerable pain level for him. Patient states he finds it easier to breathe and denies chest pain. Capillary refill is less than 2. Patient's accessory muscles use decreased from mild to none. Auscultation of breath sounds reveal mild wheezing. Treatment for day 3. Patient's oxygen is titrated from 2 liters to 1 liter. Patient is no longer on mag sulfate. He's just taking albuterol and ipratropium treatments. Doctor recommends patient to use incentive spirometer to improve lung function. Doctor prescribes patient to perform a lung function test. Doctor prescribes a chest x-ray. Diagnosis. Provider diagnoses patient with occupational asthma. Lung function test revealed decreased volume of air going into the lungs, and chest x-ray reveals slight lung inflammation. Day 3 questions. Should a patient receiving oxygen therapy be weaned off oxygen even if they are satting greater than 90? Rationale. Evidence-based practice reveals a patient satting less than 90% should receive oxygen therapy and having the titration lowered to 0.5 liters before discontinuing oxygen therapy. Question 2. Do you expect the patient to experience another exacerbation? 2. Asthma is unpredictable and patient must identify triggers and cause of asthma is unknown. What is the biggest risk factor the patient faces for another exacerbation? Rationale. Occupational exposure to triggers. The patient had not experienced asthma symptoms since he was a child, and starting a job at a sawmill has caused the exacerbation. Labs day 3. Patient's white blood cell count is 12,000. Normal is 5 to 10,000. Eosinophil count is 6 and normal is 0 to 4. IgE is 600 and normal is 180 to 300. Studies show of the airway during asthma exacerbation suggest an inflammatory infiltrate of a mixture of neutrophils, eosinophils, and mast cells, lymphocytes, are increased in patients with uncontrolled asthma. Patients' lab values show a decrease of inflammation from previous days. Physical assessment for day 4. Patient's vitals reveal blood pressure 128/26, oxygen saturation of 96%, heart rate of 70. Patient shows no signs of distress. Auscultation of lung sounds are clear bilaterally. Capillary refill of less than 2 and patient rates pain 0 out of 10. Patient reports no difficulty breathing. Questions day 4. Question 1. What medications do you foresee the patient going home with? Rationale: albuterol sulfate, because it is a rescue inhaler used for emergency use in case of another exacerbation. Question 2. What patient teaching do you foresee the provider mentioning to the patient on how to prevent future exacerbations? Rationale: consider changing occupations. The workplace has caused an exacerbation in the patient due to the sawdust. Question 3. What device can the patient go home with that will help improve lung function? Rationale is incentive spirometer. When you use as directed, can help improve lung function. Values for the last day. Neutrophils show 60, normal is 40 to 60. White blood cell count is 9,000, normal is 5,000 to 10,000. IgE is 400 and normal is 180 to 300. Patient's lab work shows acceptable values. Patient is ready to be discharged.